My name is Barbara Morningstar, and I'm with In Autumn's Cocoon Education. The series of conversations that I am hosting with seasoned professionals in end-of-life care are designed to dive deeper into the heart of the end-of-life experience and the challenges and the gifts of the journey. Today, I feel really blessed to have as my guest Dr. Michael Kearney, and I'm hoping I pronounced that right. I usually say you can correct me later on. He's originally from Ireland and now lives in Santa Barbara, California. He is presently the medical director of the palliative care consultation service at Santa Barbara Cottage Hospital and medical director of a community palliative care team. He also works at Serenity House, an inpatient hospice house in Santa Barbara. Michael is the author of numerous books on death, suffering, and healing. Our discussion today will focus on the ideas and material in his book, The Nest in the Stream, Lessons from Nature on Being with Pain, specifically around self-care for professionals working in the end-of-life field or with the dying, discussion around burnout, compassionate fatigue, moral distress, and then deep resilience that can come from that as well. And before COVID, I know as I traveled, many professionals in end-of-life care were struggling with the added stress of isolation and limited visits and pressures on staff. I know this is an even greater theme that needs to come to the surface for discussion and support. So thank you, Michael.
You're welcome. Thank you. Thank you for the invitation.
So I'm actually going to start with a quote from the foreword of your book, and I'll get my glasses on here. It's the foreword of your book, The Nest in the Stream, was written by Joanna Macy, who I can see from your writings has had a great and beautiful impact on your life. And she writes, "The Nest in the Stream is the story of a man who dared to face his moral discomfort as a physician and question the medical model of his training, even his own suitability for that profession, when he realized the inadequacy of what he had been taught in the face of his patients' uncontrollable pain and suffering." The book soon moves beyond his personal story to examine how we relate to our world in this time he calls a tsunami of suffering. It also shows us how life comes to meet us when we are not afraid to be present to that pain. So I think that's a beautiful beginning, and I love how she honored you in this, because even as a professional, as a physician, where you're having to put up this, or initially invited as professionals to put on this stoic front, you take us in very often vulnerable exploration of the truth of being present to individuals. So I want to talk about a turning point in your life, what I call a calling, and then I'm going to turn it over to you. But in life, we see often turning points come in accidents or illness or a death. But in more subtle ways, there can be whispers of an invitation to a different direction. And if we're open to hearing that whisper and accepting the invitation, then our life takes on a different journey and tapestry. So you began medical profession in Ireland, and then we're struggling with even questioning whether you would stay within the medical arena. And then at a spiritual retreat, there was one of those serendipitous conversations. And this individual suggested that you visit St. Christopher's before you made a decision to leave medicine, which was a hospice in London, England, that was started by Dame Cicely Saunders. And interestingly enough, he said to you, it's a place of healing, which to many of the listeners, they would think a hospice is a place of healing? That doesn't make sense. People are dying. So could you talk about that turning point for you, stepping into St. Christopher, and how that changed the direction in your experience in medicine.
Sure. Yeah, I'm happy to. So, yeah, as you say, I kind of, found myself in medicine maybe because I came from a very medical family, and it wasn't that there was a great expectation that I should do medicine, but it was a sort of a well-worn path. And so, anyway, I found myself in medicine, and then had this sort of crisis of meaning about halfway through my medical studies, when I actually saw and experienced what was happening in on the floor in the wards with the patients. Up to then it had been just kind of more academic scientific subjects, but I was hoping that when I actually got to meet real people that I'd feel differently about it. But it sort of was a little bit the opposite. I kind of got to the floor and was really disappointed by a lot of what I saw, or just felt, was witness to some instances that just seemed unkind and really, yeah, unkind, maybe, just to leave it at that. And so, in parallel to my being in medicine, I was also very interested in English literature. I was interested in making movies. I had a kind of an interest in the humanities, and I was wondering maybe that's really my calling, more in that direction. And was on the verge of kind of leaving medicine, really seriously considering it. When, as you say, I had a conversation with a mentor figure of mine who, at the time, who said, look, before you leave medicine, I ask you to do one thing, and that's to visit St. Christopher's Hospice in London. It's a place of healing. And there was something just in that phrase that I think resonated very deeply with me in retrospect. But certainly at the time, it was enough to sort of pique my curiosity. And so I went and I participated in a 1 week interdisciplinary training at St. Christopher's. And I think it was in the course of that week that I kind of actually, I'm not sure I remembered that phrase, but again, in retrospect, I can see that I actually experienced what that phrase meant from just encountering individuals and families, sitting at the bedside of people who are very close to the end of their lives, and yet seemed very alive and very vital and very whole. And there was something in that kind of touched me very deeply. And so my real kind of stepping into the world of hospice, that was before it was called, there was a field of palliative care. It was just kind of hospice at that stage. That was back in the mid 70s. And it wasn't so much that I really wanted to work with people at the end of life. It was more that I was really interested in what it meant to become whole, and what healing was all about. And it seemed like a lot of my training to date had been about the prevention of disease and the kind of treatment of disease, and attempts to cure disease, or at least palliate disease. But there really hadn't been any consideration given to what healing was all about. So that became the doorway. And so I've been, I went back and completed my studies, had a sense of direction. Before I left St. Christopher's on that occasion, at the end of a week, at the end of that training week, each of the participants in the course had an opportunity to meet with Cicely Saunders, Dr. Cicely Saunders, who was the medical director there at the time. And when I went to her office, there was a young Canadian surgeon there named Balfour Mount.
Yes.
And he had come over from the Royal Victoria Hospital to see what was happening in St. Christopher's, because he was interested in interested in what he heard. And as you know, he went back from that visit and started the first hospital-based palliative care program, I think, in the world, as far as I'm aware. And it was he who coined the phrase palliative care. And so, our paths crossed, and Val and I have been colleagues and friends ever since, and that's been a real blessing. But so, and have shared that interest in whole person care, in what healing really means, and how helping our patients towards healing, encouraging them in that direction, facilitating the process as best we can, because essentially this is a process that's got more to do with what's happening internally within the person than it has to do with something any of us prescribe for that person or do for that person. But kind of realizing that process is intimately connected with our process as caregivers, and that they're kind of, in a way, seamlessly intertwined. And so yeah, that was the very beginning of my time, and I've been working in the field now, I think, a little over 40 years since then.
Wow. Well, and your last comment bridges beautifully to my next question about the wounded healer. And you're with patients going through this and their families, but you're also a human being with your own history and your own heart and your own tapestry that's coming and engaging and in the background, but also woven into the story. So the concept of the wounded healer, I want to touch on that. And the moment for you did go and work at St. Christopher's eventually, and you were having rich experience, but then there was a moment where you had to give the news to these little children that their mother was dying, and walked away and were impacted. And then a lot of things came up for you on a deeper level. Could you share the concept of the wounded healer and your personal experience around starting to discover your own heart in this process that you weren't prepared for initially going into it, or expecting it in the same way?
Sure. Yeah, I think that encounter you described, that was about 3 months into my time working at St. Christopher's, and I was absolutely loving the work. But I think I was, in a way, a little naive about just how present I could be to so much suffering. And in a way, at that stage, I really hadn't done any sort of self-reflective work of any kind. And in retrospect and looking back on it, I think what I hit at that point, 3 months into my time at St. Christopher's, was, what we now recognize as sort of vicarious traumatization, or just kind of being overwhelmed by the suffering of others, and how that can kind of impact us, and we become secondarily, kind of traumatized and affected, and so, that was the beginning of my sort of, I was going to say lifelong. It is continuing, although I'm not still in psychoanalysis or psychotherapy as I was for many, many years, but a sort of an inward journey that was kind of paralleling the outward journey that seemed to be, at first seemed to be just about coping and surviving a difficult time, but then realizing actually that that was just part of it, and the bigger part of it is kind of really contained in that story of the wounded healer. And the story of the wounded healer, just very briefly, it comes from the Greek myth of Chiron. Chiron was a centaur, who, meaning he was half human and half animal. He was half horse, half human. And the kind of short version of the story is that he was wounded by a poisoned arrow. And because he was a demigod, he was not just half human and half animal, he was also, one of his parents was one of the gods, so he was a demigod. It meant that this poisoned arrow didn't kill him as it would a normal mortal. And instead, he lived a long life, but with a gaping wound. And so the story goes that he wandered the hillsides of Mount Pelion, kind of discovering all the different herbs and their different healing properties. And he became a great healer. And so many came to him and they saw him with his wound, and they saw that he was able to offer them these healing remedies, but that himself, he was wounded. And my understanding of that story is that they actually experienced in his presence somebody who deeply understood their suffering. And so there was this kind of deep connection and compassion, even if he wasn't able to fix their problems. And then again, very briefly, the psychodynamics of the wounded healer, kind of drawing on Jungian psychology and the whole idea of archetypes. But the psychology of the wounded healer is the idea that each of us as individuals have within us an inner wounded one and an inner healer. And when we find ourselves, living with an illness, with a disease or an illness, then that sort of constellates the inner wounded one, and that kind of comes to the surface. But the inner healer is still there. It's still innate and within, but dormant and asleep. And then the helper, the caregiver, tends to embody the inner healer, but their inner wounded one is present, but asleep. And the dynamic of the wounded healer is somehow where we meet as two human beings, one of whom happens to be the patient and one of whom happens to be the caregiver, but both of whom carry within them this healing potential. And the caregiver is being present in their humanity, even living with the limits of what they can do, even saying, I'm sorry, I can't fix your illness, I can't cure what's going on, but I'll be as present as I can, and I'll stay with you as best I can. That acknowledgement of our humanity and of our limits, in a way, is an acknowledgement of our inner woundedness as caregivers. And that allows us to be present in the wholeness of who we are as individuals, which actually constellates and awakens the inner healer in the other. Mm-hmm. And so, the Sufi poet Rumi, he talks about, he says, keep looking at the bandaged place. That's where the light comes in. Mm-hmm. That's where the light enters you. And so in a way, that's when we're present in our humanity to our patients, as well as our professionalism, that both encourages the one who is suffering to stay with their suffering, and it also awakens their innate inner healer. And so, I mean, that's the kind of conceptual, archetypal description of, I think, what is, for those of us who've been in this field for many, many years, the experience of healing that we experience when we're in the presence of somebody who is suffering, who we've, come alongside and connected with and maybe even befriended. And, that I am healed in that experience as well as the other, being touched by that healing.
It's beautiful. And actually, my husband died of cancer in 2008, and he had 3 primary cancers. 2 ended up were marrow cancers and affecting the constitution of the spine. It was not an easy death. There was a lot of suffering. And on one level, you might say it wasn't a good death. But when you stood back and held, if I reflect back on it and I stood back and held it with love, there was a breakthrough. Despite the challenge of pain management, he broke open to a place of loving that was breathtaking. In the He'd lost a wife to cancer prior to his dying and had never dealt with those deeper wounds, right? And they came forward. And so on one level, you wouldn't wish that journey on anyone. It was tricky. But on the other level, to what you speak of, the healing was breathtaking. He was not cured. It was not an easy passing in the end, but the healing and the connection to his heart was stunning and had a profound impact on me too, as his partner and in my work in hospice as well. So
Beautiful.
yeah, it's rich, right?
Very, very rich.
Yeah. So let's move a little more deeply into because now we're moving into the role in a professional sense and being a human being as well. We hear the words used a lot, and I'm big on words that get used in a cliche kind of way. I kind of like to go deeper into, okay, what does that really mean? And we hear, especially now, about burnout and compassion fatigue. So can you define for our listeners? I mean, professionals will have heard those words. We're hearing it more with the COVID events. Can you define those words, burnout and compassion fatigue, what they mean?
Of course, yeah, happy to. And maybe I could also touch on moral distress, because there, we now think in terms of those three different occupational stress syndromes, and in a way, burnout is the common end point of all the different occupational stress syndromes. But burnout, as I've come to understand it, I mean, it has its own set of symptoms, which I'll describe in a moment, but the genesis of burnout as a primary occupational stress syndrome is the kind of stresses that are generated between us as individuals and the more bureaucratic side of our work environment. Back in 2008, I was a co-author on an article that was published in JAMA on self-care of clinicians working at the end of life. And we followed an oncologist's story through that article. His name was Dr. C. And Dr. C said, the stuff that burns me out isn't losing my patients, it's fighting with insurance companies. So that gives you an idea, that kind of mismatch between our values, the amount of effort or time we're putting in, and how we're recognized and validated by the system that we're working in, are just so much mountain of paperwork, those kind of stresses. So that's burnout. And then the symptoms of burnout are physical and emotional exhaustion, and a kind of exhaustion that you don't get over with a weekend break, even a vacation. You come back and you're still bone weary. You've just kind of run dry. And then the second symptom is a sense of dissociation, just not feeling as engaged in one's work, feeling a little disconnected. And then the third symptom is what's called lack of personal accomplishment. And lack of personal accomplishment means one just isn't getting the sort of job satisfaction or achieving the kind of outcome and feelings of satisfaction that go with that one would hope. So that's burnout. Then vicarious traumatization, compassion fatigue, secondary traumatic stress, they're all come together under the umbrella of compassion fatigue. So compassion fatigue is the common term, but and we can say, I'd like to say more come back to compassion fatigue later, because I think compassion fatigue as a term brings up some interesting kind of considerations. But when you look at the literature on compassion fatigue, Charles Figley and so on, they're writing about vicarious traumatization and secondary traumatic stress. So what's happening there is that when we are present empathically to somebody who is suffering greatly, we may be at risk of being secondarily traumatized. And so Charles Figley talks about how empathy is a kind of a two-edged sword. It's a connecting, it's a facility for connection, but it's also opening the, it opens the door, it makes us vulnerable. And so one of our co-authors on our JAMA paper was Richard Harrison, who is a clinical psychologist working in Vancouver. And Richard, he coined the term exquisite empathy.
Yes, I love that.
As opposed to regular empathy, if you like.
Yeah.
And what exquisite empathy is, it's empathic engagement with self-awareness. So if we're mindful, if we're aware of, how we respond and react in the presence of suffering, when we can recognize the warning signs in terms of being overwhelmed or something that's just getting to us, and in a way that's really that we're vulnerable to. So we have that combination of self-knowledge and mindfulness. Then we can be in a situation, even with somebody who's in great suffering, and we have the capacity to self-monitor, to kind of engage closely, be connected, but at the same time we're self-aware and mindful of what's happening. And so we can sort of self-regulate, if you like, in the encounter, move in closer or take a step back and ask a colleague to come in and help if that's what we need to do. So that's exquisite empathy, which he describes as highly present, sensitively attuned, well-boundaried, as in sensitively boundaried, rather than rigidly boundaried, and heartfelt. So it's possibly to be there in a very open-hearted way, but mindfulness gives us this kind of porous protection. It's not a rigid protection, but it allows us to be in those highly charged situations, very intense situations, without being overwhelmed. And then the symptoms then of compassion fatigue, as in vicarious traumatization, secondary traumatic stress, are really the symptoms of PTSD. So one sees hyperarousal, avoidance, and so on. But over time, compassion fatigue can lead to burnout, and indeed that comes into my story in The Nest and the Stream. I think that's what I experienced myself over time. And then the third syndrome, which has been kind of more recently described, as in the last 15, 20 years within the nursing literature primarily, but I think it's now recognized as just absolutely endemic and very common, not just in healthcare, but in our society, is moral distress syndrome. And moral distress syndrome is the sort of stress that's generated when we're in a situation where we know internally what we like to do, what we need to do, what we want to do, what we feel is the right thing to do, but we're constrained from acting on that by external circumstances. And that generates a particular kind of stress, moral distress, which can kind of over time erode our sense of self and self-esteem, and take its own individual kind of consequences. But if it becomes chronic, can end up in burnout. So that's why burnout is the common endpoint of the various stress syndromes.
Well, I love the wording of exquisite empathy, because as you said, I've been in the hospice field for over 25 years, and I've often seen kind of two extremes. The people I say get armored up, and you've talked about armored up, and so I'm going to defend and not let you. But then over time, they kind of get stiff and unapproachable, which is kind of, and you love them. You remember at the beginning what they were like, and or the one with little boundary and engage and get entangled, and then how do you pull them, and they're sure they're doing the right thing, and it's like they're on the family dance floor, and you're trying to pull them off, and it's kind of becoming a bit more of a mess, and when you try to help the boundaries come in, they project, and there's their own wound being touched in on there. So the balance and the beauty of just even knowing the counter to a burnout, or the hard words we hear, when you start to hear the gift of a wisdom coming in those words, is kind of lifts something in itself. I find. But
That's
moral
right.
distress I'm seeing more of too, just with what's happening now. But even in Canada, when MAID came in, we're not going to go into, that's a whole other unique experience, but with medical assistance in dying. But for some, it was a different concept in palliative care, and some were comfortable and others had to work with their own reflections around that. It's not just that theme, but, how do you support people when they're in moral distress to work with that conflict? That's not that's a that's not a one answer, an easy answer. It's layered, but how
Well,
for you is that come?
I guess where I see it on a day-to-day, in the acute hospital setting where I work mostly, is a sort of intensive care unit setting where somebody is on a ventilator and on pressers and on kind of just full support, but it's kind of just really clear to everybody that that this person's body has kind of declared that it's just not able to make it through this, and yet there's a family member who's the decision maker for this person, who has decided that this is what they want to do, and they want to. And I've seen situations then where somebody is still full code, and then the nurses are the kind of ones at the bedside, so they're often the first ones to have to go in and start CPR if somebody, and they're doing this in a situation where they just feel it's really going against something that they feel, that this person, and it may well be kind of an added element of that person may have said prior that they wouldn't want to be put on a ventilator or kept alive if they were ever in a situation like that. And so, that's the kind of situation where I kind of on a day-to-day see more moral distress in the hospital setting. And, I think sometimes, obviously one does one best to kind of, through communication, to sort of resolve things externally, and kind of, family meetings and really listening to the ones who are making those decisions on behalf of their loved ones. And I think that goes for our colleagues as well, who are feeling that they're having to act against their sense of what the right thing to do is in a situation like that, is at least, just really taking time to listen, and to listen to their, not just to their point of view or their argument, but to listen to really get a sense of their suffering and their pain, so that they, even if it doesn't in the immediate change the outcome of what's happening, if that individual has a sense that they've been seen and heard in where they are, I think that makes a difference.
I am going to share a little. I shared this with my call. I held a support group the other night with some palliative docs and seasoned nurses, and I shared a story that was quite moving on this, and it was on both sides, because as I said, my husband's death was not easy, and he had an epidural line that failed, and then infusions were brought in and that didn't work, and sedation was brought in at the end to pain management. It was a unique situation. I knew many of the doctors. I knew their intent was positive and pure, and yet I was still the spouse, right? So it took me a while to sort of work through how suffering and the impact on my heart with someone I love. And so, but a year later, the provincial organization asked me to be a guest speaker at a conference and talk about the truth of going through the system. And so I was in this interesting place of I'm a professional and I was the caregiver to someone I loved, and it was not an easy death. And I wanted to, it ended up in a presentation on how, can you feel the pain in my heart too? But in the presentation, I went deep into honoring the professional, but also helping them see the truth of the human side of the caregiver. And at the end, finished the talk. It was deeply moving. And I didn't know there was a young physician in the audience, beautiful young woman who had done her palliative rotation while my husband was dying. And she came up to me. She was now, in that role. And she just looked at me and said, "Can I have a hug?" And I said, "Yes." And so I held her. And as I held her, she just completely wept in my arms. Just completely. She's the physician and I was but now there's this beautiful thing happening. And I just held her. And we didn't say much, and then she left, and then a couple of days later I was in medical rounds, and she just serendipitously happened to rotate in to be the physician in the hospice that day and in medical rounds. And she came up to me and she said, "I want to show you something." And I said, "What?" And on her camera she'd taken a picture, and she'd gone to the beach and she'd built two little inukshuks, which not everyone will know what those are, but they're native. Here we call it First Nations, little kind of stone sculptures that would be put out sort of as for travelers to know where safe areas were. And she said she built an inukshuk for each of us. And so there was this stunning moment of caregiver, doctor, professional, heart to heart, and a ritual she did. So yeah, I'm just honoring what you said. The professionals are in a role, but then there's still human beings engaged with other human beings. And how do we when we hear the stories of both sides, sometimes there's this grace that happens,
Thank you. Thanks, Barbara. I mean, I think what you've just described beautifully is a kind of a moment of profound healing. And that what happens in a moment like that is, in some ways, the sort of our persona of being, whether we're the professional or whether we're the one who's being cared for. I mean, that just isn't what it's about. What it's about at that moment is human being with human being, and something happening. That's just that flows back and forwards. It's not a kind of above down. It's back and forwards. A phrase that kind of makes a lot of sense to me is, that in suffering our suffering together, we come into the mystery of healing. And we talk about compassion as compassio, to suffer with, and when we actually live that, when we actually come into that moment of compassion with another and with ourselves, we just find ourselves in that deeper mystery that is healing, that is just hard to find words for. But I think you described it beautifully in the story.
So I just I'll go into another thing that you would do the things that everybody said. "Oh, I've done the research. I think I'm burning out. I'll go get more massages or go on a holiday," but then you found that you just keep coming up to this place, and why am I still feeling this? Why is this still happening? I know there's more literature now that challenges. We're so good at holding space for other people's grief as professionals. Are we really allowing our own selves to grieve? And this is why I love your book and the journey that you share, because you are courageous. You're like, I'm not going to let this go. This, I need to understand this in myself. And then so beautifully, you, again, an invitation, a whisper into nature and different forms of ritual. John Young, the connectedness to nature's had a great impact on your life. And then sweat lodges and vision quests. And so can you talk about nature and ritual and how that even deepened your journey of self-awareness and healing?
Well, yeah, I'd be happy to, but I'd like to just back up a little bit because, as you say, what brought me into that was really a sort of light bulb moment when I was finishing up that article and kind of reviewing one more time the symptoms of burnout and realizing that, that's me.
Mm.
I really don't have the same sort of joy and passion in my work in palliative care that I had, 25 years ago at that time, when I go into work in the morning and I don't feel like I'm doing the sort of quality work that I used to do. And I feel a little detached from it all. Boom, boom, boom. Just, I had all the symptoms of burnout. And yet I was practicing everything that we were advocating in the article. I sometimes think of self-care as three models of self-care: practical self-care, psychological self-care, and spiritual self-care. And I see practical self-care as what we kind of do without thinking, as kind of default self-care, where we have sort of professional boundaries that kind of protect us, whether it's our role or whether it's our white coat or whether it's, and then we take time out and so on. So we have our boundaries, and then we have our activities that restore us and, renew us. And that's the practical model of self-care. So I was doing that, and I was also doing what we were really advocating in the JAMA article, which was a more psychological model of self-care, exquisite empathy, mindfulness, self-awareness. I was practicing mindfulness. I was in therapy. I was, doing the best I could to understand who I was and what I was bringing into my work and who I was bringing into my work, and doing that mindfully. And yet here I was with all these symptoms of burnout. So I really kind of tried to understand this, and I couldn't figure out what had happened or why this was happening. And it was a moment in nature where I began to understand it more fully. And I was on a retreat with a Native American couple here in California. And they sent us all out on this afternoon. They sent us all out onto the land around the retreat center for about 3 hours. They said, just wander out, find a spot. And what we ask you to do is to notice whatever question is on your heart at the moment, and to bring that question with you out onto the land. Find a place that kind of speaks to you, rest in that place, listen in that place, notice in that place. And then let's come back and sit in a circle here and see if anybody's got anything to share. And so I wandered out, and I knew this property, this land pretty well. And there was a creek there. There was still some water flowing through the creek. And when I came to the side of the creek and looked into the pool in front of me, there was a bird's nest sitting in the pool. And hence the nest in the stream. But the pool was, the nest was in the pool. The water was flowing slowly flowing through this nest, which was a beautiful big, I think it must have been a hawk's nest. It was really big, and the twigs and the coils were kind of open enough that the water was able to flow through. And so, and I got this kind of sense as I was looking there. A phrase came into my mind, and it was the words, the loose and open weave of the heart, the loose and open weave of the heart. And so I kind of went back into the circle, and I shared my story, and shared those words that had come to me. But it was only weeks later that I realized, maybe that was an answer to the question that I was holding, which was, why was I burnt out when I was doing all the right things? And so what I came to realize is that a couple of things. One is that I realized that I was suffering from sort of chronic compassion fatigue or chronic vicarious traumatization. I described earlier how I experienced acute vicarious traumatization at that family meeting with those young kids at St. Christopher's, 3 months in. Now, this was different. This was 25 years into my career. And this was just the sort of under the radar kind of suffering that we're all exposed to in every encounter we have with a patient, with the family, with our colleagues, the stresses, but the pain, the grief. And, and then we move on to the next patient and the next patient and the next patient. And we've got 20 people on our list, and we've, got 6 new consults, and on it goes. But all the time we're, our psyche is impacted and affected by these losses. And so I sort of kind of realized that. And the other thing I realized was that in the nest in the stream, I was sort of being given what I feel was a sort of an answer, not just to what was going on, but what I could do about it, or what could make a difference, what could help me to live with my pain in a less harmful way, possibly even in a more wholesome way. Is there such a thing as a good way of being with pain? And that's why the title of The Nest in the Stream is Lessons from Nature on Being with Pain. And so yeah, that's, I come back to the term compassion fatigue, which I was talking about, earlier. And, I now see that compassion fatigue is that in some ways part of the problem was there's a teacher you may be familiar with from the Zen Buddhist tradition. Her name is Joan Halifax, Roshi Joan Halifax. And Roshi Joan talks about compassion fatigue, and she says she really has problems with the term compassion fatigue because true compassion doesn't fatigue. And so the way I kind of understand that is that it's like as though there's compassion with a little c, or little compassion. And that's the sort of compassion that I'm capable of as the individual I am, of offering others. And that's beautiful, and that's, often very helpful. But that's where we're vulnerable too, that if we think that we really can hold, if we think we can hold another person's suffering, if we think we can heal another person's suffering. And so kind of sensing the difference between compassion with a little c, and I think the whole syndrome of vicarious traumatization and secondary traumatic stress go with that sort of compassion with a little c, or that sense that it's all up to us. And then alongside that, or deeper than that, is the great compassion that Roshi Joan talks about, which is something deeper. It's part of the deep mystery of healing that we kind of touched on earlier. That, it's not to say it's got nothing to do with us, but it's something far greater than us. And so for me, the metaphor, the nest in the stream is a metaphor where it sort of brought me into was that sense that I don't have to hold all this suffering on my own. It's too much for one little human being. That, that the earth has my back,
Mm.
and that I can let my suffering go to the earth and know that the earth is holding this suffering with me. Or, the earth, for me, it's the earth, that I come into that kind of, that sense of I think I've always had it for a long time in my kind of Celtic background. And then with my Native American teachers, and as you mentioned, nature connection practices through John Young and others have kind of brought it more and more into awareness and more alive. But that sense of the aliveness, and so that, yeah, I still can be highly present, but I don't have to hold it in my two little hands all by myself.
Well, and the expectations that we put on ourselves, I've noticed that even some of the younger dogs sometimes coming in, or the seasoned ones, the expectation that we of a good death, or that it has to be a certain way, and life and nature, we can set it up as best we can, and then life's going to take over, right? So the way you've talked about the little C and the big C is beautiful, because there's a mystery woven into all of that too that we can't control, right? So.
Well, for me, that's what what the third model of self-care is about. I talked about the practical model, good boundaries, rest and relaxation, the psychological model, self-awareness and mindfulness. And then the spiritual model, it isn't a religious model, but it's more of a sense of the power of healing connection. I don't know if are you familiar with that paper from Belmont and Pat Boston and Robin Cohen called Healing Connections? It's an amazing.
I've read
article.
other ones, but not that particular one. But
so this was a study, a qualitative research project that they did with people at the end of life. So they had 20 people in the study, 10 of whom were suffering greatly, and 10 of whom were rating their quality of life as being really wonderful. And but apart from those huge differences, they were otherwise matched in a very comparative, similar sort of a way. So the same diagnosis, social demographics, everything else similar, but just one group suffering greatly, one group thriving, and they were very close to the end of their life. So they talked with them, they interviewed them, and they tried to find what was common to each group. And what it all came down to was basically the presence or absence of what they called healing connections. If an individual has a sense of being connected to themselves, to others, to the phenomenal world, or to ultimate reality, however that individual understands ultimate reality, whatever that means to them. If that individual has a lived sense of connection in any of those four areas, it transforms their experience. They have a sense of meaning, they have a sense of connectedness. And then the other side of that is individuals who don't, individuals who are disconnected, or just don't have that sense of connection to themselves, to others, to the phenomenal world, or to ultimate reality, are just in this place of isolation, which can be a place of a lot of fear, and a lot of lack of meaning, a lack of hope, a lot of suffering and distress. And so, for me, that's what kind of a spiritual model of self-care is all about, is that us as individuals, as caregivers, kind of noticing where and with whom and doing what and how do I come into a sense of healing connection, of deep connection. What brings me into that place, and really having that as part of one's life, really building in, whether that's through meditation, whether that's through time with one's loved ones, whether that's listening to music, whether that's spending time, in nature, with nature, whatever really brings one into that sense of deep connection and mystery, is deeply, deeply, deeply restorative. And that allows us to be present to another's suffering, because we're standing in a much deeper, much bigger place. We're not in a way, little compassion with a little c is me listening to another's suffering from a place of isolation. Compassion with a big C is me being present to another in their suffering with my feet on the earth, with that sense of kind of deep connection, that sense of I am being held. And because I know I am being held, I can be present. I can be, highly present to another in their suffering.
That's beautiful. And near the end of the book, you actually say, I'm no longer burnt out and I don't want to change my profession at that time. But you can, just what you've explained kind of gives us a deeper insight into what shifted in you to come to that place. And the nest is such a beautiful metaphor for that.
Such a gift. It really was such a gift.
That's lovely.
I think that's one of the extraordinary things about other than human nature in the natural world is that, that if we really come towards the natural world with a question on our hearts, maybe, but with a sense of, a sense of deep respect and a sense of listening and a sense of receptivity and a capacity to wait and to watch. And if we really, through our senses, take time to connect, through seeing what we're seeing or hearing what we're hearing, touching what we're touching, smelling what we're smelling, tasting what we're tasting, that we can be surprised by what comes towards us.
Well,
when we I don't know if you've got a story about that from your experience.
Just honoring, I live in British Columbia, so nature abounds around us. And yesterday, my partner and I decided to go for a hike. And I've been just preparing for this, and we were talking about all that you were reflecting. I mean, I've loved nature since I was a child, but we've often looked at the artwork in nature as we're out in these rich old growth forests and looking at the birds. I'm by a lake right now and we watch the birds every day on the lake. But there was a place yesterday we came to and a log had fallen over. It was an old log and we were talking about all of life being in the forest. And it was this, and my partner said, there's this old log and it had moss on and it was dead. And there were these little ferns coming out. And he said, I just hugged him after this, but he said, I see the log as the grandfather who's died. And yet his wisdom is still there because the little ferns are shooting off. Even if the ferns didn't know the grandfather, the wisdom of the grandfather is coming up through the ferns. And my father just died. He was 98 in July and just a great human being. And so I said, well, yeah, that's like my dad and how the nieces and the grandchildren are now. And so we were celebrating you and your book, and just everywhere we turned, there was magic in the forest. And that metaphor of him and my partner's wisdom in seeing life and all of that in death and in the growth of that. I mean, you celebrate that so beautifully in the book. And in your work. So, yes, thank you.
Thank you for that story. That's really beautiful.
So I want to end with a question, a deeper question for you. And it's about your heart. I mean, you've talked so beautifully of your own journey in this. And so if you go deep into your heart in this final question and to share with the audience, both professional and in the public, what do you think it is about this work that has kept bringing you back? What is it about this work that has called you in a deeper way? And how has your heart truly been transformed by serving this way? Just a light question to end with.
Well, I think what has really, why I've kind of stuck with it, because part of my questioning when I realized I was burnt out is one of the symptoms I had a burnout, which wasn't on the classic list of, exhaustion and depersonalization and lack of personal accomplishment. Yeah, I had all of those, but I had another symptom, which was I was constantly kind of thinking about, a career change, and which is something I'm not thinking about anymore, and I don't feel like I'm burnt out anymore, as I, and I think that's true. But what kind of keeps me going, and I look back over the last 40 years, and I think what has kind of kept me going and in a way fed my heart, really are the people I've met, the people I work with every day. I just love I love meeting the people. I love going and sitting at a bedside and listening and encountering yeah, that really is what kind of in the work, that's what nourishes me. Meeting, yes, I've been blessed in so many ways, and I've got a wonderful team that I'm working with, and colleagues and opportunities, but really the kind of day to day, what's really feeds my heart and what keeps me going are those moments, which Richard Harrison calls exquisite empathy, but are those moments, and they might be just a little moment in every day or a few times where there is that connection and that encounter, and there's something kind of flowing back and forth, and I see it perhaps in how that person is responding, and I feel it in myself, so it's that suffering our suffering together, we come into the mystery of healing, and so I think that's really in my day-to-day work, that's what nourishes my heart.
Well, I just want to thank you for taking the time to come and have this conversation. I have the book here. I don't know if you can see it. The light's hitting it a little differently. It's The Nest in the Stream. It's a smaller book, simple in many ways, but so rich. I've dog-eared it. I have little markers. I love this book because it's so heartfelt. The other reason this is a beautiful book, I just did a series on men's grief, and men's grief is often missed because of the testosterone. Men are wired to kind of connect with their emotion and their grief process differently, and it's often through activity and ritual. And this is also a really beautiful example of all the things we've discovered of how when men really connect with that and go into their process in ritual and activity throughout tribal culture is shown. It's a beautiful example of that and where that can take you in healing to another place. So I thank you for that, because my next interview is actually around men's grief, and your book is a beautiful role model and example for men to be courageous to go into the vulnerability, because there's rich growth there and connectedness, right? So The Nest in the Stream. Your website, michaelkearneymd.com. I'll put that underneath the link of the interview, and we have it up and available. But thank you so much for taking the time.
And Barbara, thank you so much. I've really enjoyed this conversation very much. And thank you for very much for what you've just said about my book, and thank you also for mentioning the website. But I just do want to let people know that on the website there are some guided meditations that are free, downloadable, available, and they really are practices. They're practices that I've based on guided meditations that I have done with patients at the bedside, that really allow us to connect with nature, you know, in the hospital bed or in our own bed or in our meditation practice, wherever we do that. So anyway, just to say, those meditations are there, they're available, they're free, and anybody wants to check them out, please do. But thank you, Barbara. It's been lovely to talk to you, and I wish you well with all you're doing, your good work.
Yeah, thank you so much. I appreciate it.